Fugitive Facts Podcast, Hospital Episodes, the hidden interruptions that disrupt your sleep during a hospital stay.
Why did you wake me up?
You're in a hospital bed, trying to recover from an illness or surgery. The room is quiet, and you're finally drifting off to sleep when suddenly in comes the tech to check your vitals. It's a scene that many of you can relate to or imagine. But why is sleep so important? And what are the hidden impacts of losing it? Sleep is essential for your body's healing processes. Interrupted sleep can slow down your recovery, making it harder for wounds to heal or your immune system to fight off infections. Just think about a patient recovering from surgery. Studies have shown that patients who get enough sleep heal faster and have fewer complications than those who experience frequent sleep interruptions. Sleep deprivation can increase feelings of stress and anxiety, which are already high when you're hospitalized. This can affect your mental health and overall experience. According to the National Sleep Foundation, patients experiencing sleep deprivation report higher levels of anxiety and stress. Lack of sleep can lead to confusion, memory issues, and difficulty concentrating. This can mean misunderstanding medical advice or being unable to participate fully in your own care. What I noticed as a nurse was that patients who are sleep deprived often struggled with cognitive tasks, making it harder for them to engage in their own recovery process. So, who or what are the culprits behind these sleep disruptions? Let's uncover the main sources. Routine monitoring of vital signs is necessary, but often done during nighttime, waking you from sleep. I remember not too long ago when a friend of mine was hospitalized for about a week. She complained just as she would fall asleep, a nurse would come in or a tech to take her vitals, disrupting her rest. She was furious. Now, there are medications that need to be given at specific times, including overnight, that can interrupt your sleep cycles. A good example, certain medications must be administered every 4 hours, even during the night, causing sleep interruptions. There are many tests and procedures that require fasting or specific timing, often leading to early morning or late night disruptions. Imagine needing a blood test at 5 a.m. because you have to fast for it. This early wake-up call can disrupt your sleep cycle significantly. Noise from medical equipment, conversations, and even hallway traffic can prevent you from getting a good night's rest. A study published in the Journal of Hospital Medicine found that environmental noise is a significant contributor to sleep disruption in hospitals. But all is not lost. Let's dive into some practical ways you can use to improve your sleep quality during a hospital stay. One thing that patients usually don't do is express their sleep preferences. It's okay to talk to us doctors and nurses about your usual sleep patterns and preferences. Not always, but sometimes we may be able to adjust your care schedule to minimize disruptions. So here's a tip. Be proactive and ask if non-urgent tasks can be rescheduled to more convenient times. You can even inquire if certain tests or medication schedules can be adjusted to more convenient times. Think about it. If a medication can be safely administered an hour earlier or later, this small adjustment could make a big difference in your sleep quality. You can use sleep aids, request earplugs, eye masks, and even some hospitals have white noise machines to block out noise and light. Here's another tip. Many hospitals provide these items if you ask. Don't hesitate to request them. You can control your lighting. Ask the staff to dim lights or use a night light instead of the bright overhead lights when entering your room. What most patients find is that keeping the room dark signals their body that it's sleep time, helping them to fall asleep faster. As much as possible, try to maintain a regular schedule. Try to stick to your usual sleep and wake times as much as possible. Inform us of these times. Another quick tip: consistency can help regulate your internal clock, even in unfamiliar environments. Something else that might be helpful: you can practice deep breathing, meditation, or listening to calming music before bed. Just in case you didn't know, it's always good to avoid caffeine. Steer clear of caffeinated beverages in the hours leading up to bedtime. According to sleep experts, caffeine can stay in your system for up to 8 hours, so it's best to avoid it in the late afternoon and evening. If allowed, consider drinking a warm, non-caffeinated beverage before bed to help you relax. A cup of warm, non-caffeinated tea can be soothing and help you to wind down. You can also ask for the staff to cluster care activities. Ask if vital signs, medication, and other care activities can be grouped together to reduce the number of interruptions. A good example would be combining a midnight medication with vital signs checks can reduce the number of times you're woken up. It's okay to discuss with us if medications can be administered at times that are less disruptive to your sleep. You should feel empowered to discuss your medication schedules with your healthcare providers to find the least disruptive time. Did you know you can bring items from home, like your favorite pillow or blanket, to make sure your hospital bed feels more like at home? Once when I was hospitalized, bringing my own pillow from home made my hospital stay much more comfortable, and it did help me sleep better at night. You can always ask the staff to adjust the room temperature to a comfortable level and request extra blankets if needed. A comfortable room temperature is important for a good night's sleep. Don't hesitate to ask for adjustments. Now, knowing when to expect certain procedures or checks can help you mentally prepare and reduce anxiety about disruptions. If you know a blood draw is scheduled for 5 a.m., you can mentally prepare for it and try to sleep earlier. Don't hesitate to ask the staff about the necessity and timing of nighttime activity. Clear communication can help set expectations and reduce surprises. Now, what we've talked about is not just theory. Let's look at some real-world examples where these strategies have successfully improved patients' sleep in hospitals. The Boston Medical Center introduced a Quiet Night initiative, which included specific quiet hours, the use of sleep-friendly equipment, and staff education on minimizing disruptions. As a result, patient satisfaction scores related to sleep improved significantly. Now, at the Mayo Clinic, they have implemented a system of clustering nighttime care activities. This change has reduced the frequency of interruptions, leading to better sleep for patients and quicker recovery times. Patients reported feeling more rested and having a more positive hospital experience after the implementation of clustered care activities. By integrating non-invasive monitoring technology, the Cleveland Clinic has minimized the need for waking patients for vital sign checks. Patients reported fewer sleep disruptions and better overall rest. According to patient feedback, the use of non-invasive monitoring technology reduced sleep disturbances by 30%. These success stories show that change is possible and that by taking proactive steps, we can make a significant difference in the patient care experience. Here are just a few takeaways. Sleep deprivation in healthcare settings is a significant issue that can hinder your recovery and negatively impact your well-being. However, as a patient, you have the power to take proactive steps to improve your sleep quality. By communicating with your healthcare team, creating a sleep-conducive environment, maintaining a regular sleep routine, and using comfort measures, you can mitigate the effects of frequent interruption. And here's another quick tip. If you have a phone, you can always set your alarm to remind the staff just in case they get busy and may forget. Remember, your comfort and recovery are important. Don't be afraid to advocate for yourself and request adjustments that can enhance your sleep and overall hospital experience. As always, don't forget to subscribe for more insightful episodes. Remember, stay curious, stay informed, and keep seeking the truth. Your health may depend upon it.